The takeaway: cognitive behavioral therapy can help children understand how thoughts and emotions affect behavior and how changing their thoughts and emotions can change this behavior and the way they feel. CBT is a safe, effective therapy that can help kids with a wide range of conditions and concerns. Is cognitive behavioral therapy an effective form of therapy for children? Behavioral and cognitive theories of human psychopathology are at the very heart of cognitive behavioral therapy. By targeting multiple areas of potential vulnerability with developmentally guided strategies and flexible intervention pathways, CBT has been shown to be an effective treatment for a wide range of psychological problems in adults. In recent years, a growing body of evidence also supports the effectiveness of CBT with children and young people for numerous conditions including, but not limited to, depression, generalized anxiety disorder, obsessive-compulsive disorder, school phobia, eating disorders, self-harm, and conduct problems. Anxiety disorders are the most common form of psychopathology in children and adolescents. In children, the symptoms of generalized anxiety disorder are often exhibited as rumination on their health and the health of loved ones, school, the opinions of others, and social issues. Worrying about the potential negative outcomes coupled with an underdeveloped capacity to cope with them can be detrimental to young people in a number of ways. Clinical trials have established the effectiveness of CBT for treating children with anxiety disorders. Reinecke, D'Ancilio, and Freeman found that 55 to 65% of children no longer met the criteria for an anxiety disorder following treatment. Additionally, the results from this study indicated that CBT can potentially assist even very young children under the age of 7 in managing moderate anxiety. Back, Rush, Shaw, and Emery proposed that depressed individuals have characteristic thoughts and beliefs which maintain their depressed mood and behaviors. When depressed, people tend to remember the bad things that have happened to them, often overlooking the good things. Tharget stated that around 30 to 40% of adolescents will experience an episode of major depressive disorder at some point, with the strongest risk factors being a genetic vulnerability to depression and exposure to psychosocial stress such as parental divorce, bereavement, and abuse. CBT aims to identify and replace negative thoughts using positive behavioral skills to create and maintain positive moods and healthy relationships. Garber, Clark, and Wiersting examined the effect of combining depression education and CBT treatment of children and adolescents. Results from the study showed that group CBT programs reduced the incidence of depression in treated adolescents after 12 months, indicating that school-based CBT prevention may be a promising approach for young people reporting high rates of depressive symptoms. Multi-component CBT can lead to remediation, redefinition, and re-education in children with ADHD. Stressing the need for collaborative goal setting and training in anger management and social skills, Braswell and Bloomquist indicated that CBT for children and adolescents with ADHD is most beneficial in group treatments involving family and teachers. What childhood and teen issues can cognitive behavioral therapy best address? Cognitive behavioral therapy challenges maladaptive thoughts and unhelpful behaviors, replacing them with more realistic thinking patterns and more adaptive coping strategies. These adjustments can help bring about changes in the symptoms of a number of issues associated with childhood and adolescence. Eating disorders. Eating disorders are relatively prevalent and serious psychological disorders that commonly emerge during adolescence. Around 40 to 60% of girls aged 6 to 12 expressed concerns regarding their weight, with around 13% suffering from an eating disorder by age 20. Studies of adolescent boys with eating disorders suggest that the prevalence of eating disorders is increasing, with boys most commonly being admitted to hospital for an eating disorder at age 13. Cognitive behavioral therapy for eating disorders addresses distorted thoughts about weight and self-image through ongoing cognitive restructuring. Adolescents with recurrent binge eating demonstrated abstinence from binging following group CBT treatment. Furthermore, CBT treatment adapted for adolescents has demonstrated significant improvements in weight gain, weight maintenance, and reductions in eating pathologies at a 60-week follow-up. Oppositional defiant disorder. Disruptive behaviors such as outbursts of anger and aggression are among the most frequent reasons for childhood outpatient mental health referrals. Oppositional defiant disorder is a repetitive pattern of negative, defiant, and hostile behavior toward authority figures. Children with ODD may exhibit a broad array of problem behaviors ranging from physical aggression, destructiveness, defiance, resentment, and hostile behavior towards peers, parents, teachers, and other authority figures. CBT has been shown to produce significant reductions in ODD, providing methods by which a child can learn to solve problems and communicate in a controlled manner. Batiglis and colleagues found that greater reductions in aggressive behaviors occurred when treatment was delivered to children in the presence of a trusted parent or guardian. Deliberate self-harm. Recurrent deliberate self-harm, DSH, commonly begins during early teenage years and is strongly associated with suicide. The average lifetime prevalence of DSH is estimated to vary from 7.5% to 8% for pre-adolescents, increasing to 12% to 23% for adolescents. DSH behaviors can range from repetitive headbanging, more commonly found in young children, to intentional self-poisoning and cutting. Cognitive behavioral therapies show promise in treating DSH, particularly dialectical behavior therapy, DBT, a modified form of CBT that focuses on skills like mindfulness, regulating emotions, and tolerating distress. Research by Taylor indicated a marked improvement in DSH behavior in adolescents following 8 to 12 sessions of individual DBT treatment. Crucially, the progress made during treatment was maintained at follow-up. Low self-esteem. Low self-esteem has been associated with a number of different psychiatric diagnoses, including depression, obsessive-compulsive disorder, eating disorders, self-harm, and substance abuse. Taylor and Montgomery assessed the efficacy of cognitive behavioral therapy in improving self-esteem among depressed adolescents aged 13 to 18. Results from the study indicated that when compared with interpersonal therapy, CBT appeared to be an effective treatment in improving self-esteem among adolescents. Bedwetting. Bedwetting, known clinically as nocturnal enuresis, is a potential source of low self-esteem and has been associated with emotional and behavioral disorders. While the occurrence of bedwetting is most common in younger children, the prevalence of bedwetting in children aged 12 to 15 is estimated to be around 3%. Ronan, Wozner, and Rahaf found that children and adolescents treated with cognitive behavioral therapy were more likely to be dry for 3 consecutive weeks compared to those who received no treatment. Additionally, those receiving CBT were less likely to relapse when compared with subjects using an enuresis alarm, a commonly utilized method in the treatment of bedwetting. CBT can also assist in the amelioration of symptoms associated with bedwetting such as low self-esteem, anxiety, and embarrassment. Bullying. Bullying is a widespread phenomenon among children and adolescents, characterized by an imbalance of power, aggressive behavior, and repetitive intentional harm-doing. Victims of childhood bullying are at higher risk of sleep problems, self-harm, anxiety, and depression. Berry and Hunt tested the efficacy of CBT interventions for adolescent boys experiencing bullying at school. CBT was found to significantly reduce self-reported anxiety and depression associated with being bullied, with intervention gains being maintained at a 3-month follow-up.